Well, hello, everybody, and welcome to IRG's podcast here called NFL Start or Sit. Again, what we talk about here is last week's injuries, or maybe we're going to talk even the previous week, and that NFL player whom may be on your fantasy football team, and are you going to start them or are you going to need to sit them because of the injury? And joining me, like always, and we're so glad to have him, is Dr. Hawkins, orthopedic surgeon, sports medicine specialist down at Washington Orthopaedics in Olympia. How you doing, Dr. Hawkins?
Hey, I'm doing great. It's always good to get on and talk to you. You know, when we have a week that we miss, I honestly feel like I've missed out spending time with my best friend.
I appreciate that. Likewise, mega diddle. I enjoy this, and I personally learn a lot. I hope our listeners do. Again, for those folks out there listening, we're going to talk about that injury, and Dr. Hawkins is going to dive into it and say, well, they're going to have to sit because it takes this time to heal, or they're going to need this or that, or they're going to return to play. So again, we're going to give you time to shift your fantasy football team if you need to. And we're going to start out with a couple Seahawks, okay? Seahawks, being a Seahawk fan here myself, personally like to watch them. Gosh, they were doing pretty good in the last game they played Sunday night. It was a big night, and they just didn't look that great. So they were without Kenneth Walker III, and he's got some kind of calf injury that he's been out. I think he's been out 2 games, including the one last Sunday. And he is a workhorse. He's a bell cow, as they say. He runs the ball really well. And what do you think? Calf strain, calf tear. We talk about this. What's your thought, Dr. Hawkins?
Well, he's dealing with sort of the medial gastroc strain. So he's got a problem where he's got an injury at the junction where the muscle and the tendon come together. So it's a better injury in like the surgical prognosis than the people that have a problem a little lower in the actual tendon itself. But the hard part about it is in a running back, that's a very difficult area to, protect. So you can't wrap it up and have him go out and do what he needs to do at his position. So that's why you've seen this one stretch out. My biggest concern, Shannon, for this week is honestly what the weather looks like for this weekend for their game.
Oh, right.
Supposed to be very rainy, very wet game. And so I think that he's been not practicing. I think that he's shown that, he hasn't been able to obviously get back in even a part-time role for anything. So he'll be out probably again this week. And that's really obviously, for the Seahawks fans that are out there, it's really going to hurt them.
Yeah.
But I think they're obviously looking to sort of say they still are on the verge of the playoffs. They have the ability, and they'd like to have him if they make it. So I put him as out for this week with this medial gastroc strain.
Yeah, good call. And yeah, he is. Let's see. This will be the second. Will be the second game. Well, no, it'll just be the third game. If he's out this week, it'll be the third game. But that is a hard injury to come back. A calf medial gastroc strain. Kenneth Walker, look for him to sit this weekend. Speaking of Seahawks, here his backup is Zach Charbonnet, Seattle Seahawks running back. This guy's looked good the last couple games. I've watched him, and then it looks like he has an oblique injury. We talk about this oblique. This is the core muscle, your oblique muscles, your abdominal muscle. We call them oblique. I mean, you can't really do much, particularly as a running back, if you got a bad core muscle or a bad oblique muscle. But it looks like they're trying to work through it. What are your thoughts on this? Because this can be a little painful and difficult as a running back.
Yeah, it's a key area that a running back needs. And I think what you saw, he's shown really good potential in the last 2 weeks with Walker out, but I think you're seeing his limitations. He's been taking a lot of hard hits during that time, and I think that's what led to this. I don't think this was sort of an stress injury. I think it was probably a direct contusion, hard tackle into the obliques. So they have been resting him similarly, but I actually think that he will probably be playing this week. I think that the idea here is that they've been sort of load managing him through the week, resting him as much as possible, kind of the situation where they'll get sort of that sort of modified padding, not a true flak jacket on him, but similar to what you see the quarterbacks wear after they take that one of those hard hits to their midsection. And I think he'll be out there playing. I'm pretty sure I have the name right, but I think there's a guy named McIntosh who's their third string. Right. Yeah, and if they get that far down, I think that's really going to hurt them. So I see a platoon this week. I think Charbonnet will play. I bet McIntosh will be in there as well, probably for those stretch plays, the pass plays. But I think they'll still use Charbonnet sort of up the middle, things where he doesn't have to cut a whole lot.
I think that's what they've been doing since Kenneth Walker's been out, is using Charbonnet and McIntosh, and now with Charbonnet having the oblique. I think you're right. I think he's going to play. I would agree with you, and only because they're 8-6. They still have some playoff chances, and I think they're gonna make it, try to make it happen, so to speak. Thank you for that, DK Metcalf, Seattle Seahawks. This guy's had a season of injuries. And I think early in the season, we talked about DK, if I'm right, he had a medial collateral sprain. I think he missed 2 or 3 games. He came back. I think maybe 3 games ago, I remember watching, and he got hit at the sidelines. He went to the blue tent, as they say. He came out and got back into the game. But now we're finding out he's kind of got this aggravated, I guess it's a shoulder, and I would assume it, haven't heard otherwise, but I'm suspicious it might be one of those AC joints or something like that. And it's been problematic, and his performance is, I don't know. They're saying he's been hurt. He's been limited because of the pain he's having. Do you think he's going to play? DK Metcalf, Seattle Seahawks wide receiver, this Sunday against the Vikings. Vikings are 11-2.
Yeah, I think we can go by the history of what's been going on with him so far to make our prediction. They've held him out multiple times during practice, or they've limited him, and it's really seemed to be back to that classic load management term that we hear in the NBA all the time. It's interesting that they have been very tight-lipped about specifics of his injury, because he's been around and dealing with this on and off. I really tried to take a deep dive into it, and it does seem like it should be, based upon how they've been using him, an AC injury, but I'm actually starting to get a little suspicious. Perhaps he has a small labral tear or something like that in his shoulder. And, it's one of those things that as long as he doesn't overextend himself, he catches the ball close to his body, he's protecting himself. And, if you've been watching, which I know you have as a super fan, I don't think he's been laying out like he's done sometimes in the past. So that's starting to make me think, hey, this might be a little bit of a labral problem that, again, they have the chance of making the playoffs. And so he's such a distraction for defenses to open things up.
Yep, that's right.
For Smith and Jigba or Lockett. So I think he'll be a play, but his numbers, if you've got him on fantasy like I do, the problem is his production's been down, but I think he will play.
I do too. I think he'll play just to stretch the field. You're exactly right. I think he stretches the field. He is that deep threat, and I think it opens up the midfield for Njigba and Lockett. So, hopefully we can get our offense back cracking this week, so to speak, and get a hold of the Vikings. This guy is a gentleman that we have talked about previously early in the season. I believe last time we talked about him, he had some kind of a injury to his hand. He's a running back, and it wasn't problematic. Guy runs hard, and that's Alvin Kamara. He's New Orleans Saints running back. He's got one of these dreaded. Just if you've not ever experienced, or if you've ever had, you can appreciate a groin strain or an adductor strain. Almost everything you do in life, when you're upright and walking, you're using your adductors. Let's talk about Alvin Kamara.
Yeah, his injury is an accumulation injury. He has been carrying a bunch of small designations, and every week they were sort of holding him back. And now they've labeled it not just a hip injury; they've labeled it an adductor, and I think it's essentially an aggravation or worsening of the chronic problem he's had. And back to how we look at the season every time. They're now out of things. They're I believe 6-9. Yeah. And so I think they've sort of just said, okay, let's call it what it is, and let's plan on him not playing, because we really don't have a chance of staying in the playoff hunt. So he's listed as doubtful. And I think the expectation is he will sit. But just like you said, the adductor is a big stabilizer for the leg to the pelvis. It's sort of part of that tripod that can support the hip joint. Yeah. And so when you have an injury there, it's, you go from the three-legged tripod to a two-legged tripod, which if everybody's tried to sit on one of those, it doesn't work. It falls down. Kamara needs some rest and some time, and he needs your expertise to get back.
Thank you. I'd love to help him out. 1-800-CRISIS is my number. Just kidding you. He's definitely, I agree with you. He's definitely going to sit, thank you. I mean, in physical therapy, that's what we do that's what you're exactly right. We take care of these injuries, and we rehab them, and we rehab them by decreasing the pain, improving range of motion. Then we start working on strength and function. But I will say these type of injuries, particularly in the late to mid to late season, I mean, and we talked about this is biology, right? It takes time to heal, and you don't want to re-aggravate these injuries, particularly these groin injuries, because they can linger. And for our listeners, from an anatomical and kinesiological standpoint, the muscles, when you look at how big the muscle is, and you ask, what is the girth of that muscle? And the more girth that muscle has, the stronger that muscle is. And it seems like these muscles and these athletes, these adductors, are really strong muscles, right? And you use them a ton as a running back when you're running, stopping, and cutting. So he probably does need to get some rest, to get it calmed down, get some treatment. So Alvin Kamara is out for sure. Agreed?
Yes.
All right. Boy, here's a guy. I know it seems like we've talked about this, Nick Chubb, the last 3 seasons. This gentleman, man, I was watching the game, and he was running hard. And I was like, wow, Nick Chubb looks like he's really on fire, because has he had 1 or 2? He's had maybe 2 massive knee injuries, right? I mean.
Yeah, correct. So Nick Chubb just came off of, both as a college student and then subsequently 2 multi-ligament injuries to the same knee. So he's been coming off of, pretty devastating knee injuries, and everybody was excited that he'd spent all this time coming back, and now has this foot injury on top of it.
Yeah, do you know what it is? It's a broken foot, and they say IR, and you and I have talked about IR. IR means that you're out for 4 weeks. You're designated to be out for 4 weeks. Well, he's out for the season pretty much with 4 weeks. I mean,
the speculation on his, Shannon, and they haven't specified which bone, but given the nature of kind of what happens and what's most likely to be injured, this is probably a 5th metatarsal injury, but probably not the stress fracture, more the acute style. So the 5th metatarsal bone on the outside part of the foot, as you know. Yeah. And so if you get a break in the middle of that bone, it's usually a stress injury. Yeah. But sometimes you have an avulsion injury where the tendon pulls off the bottom of the bone, and those injuries will heal, but they usually need to be protected. He was in a boot. He's partial weight bearing with crutches. But, it's a broken bone, so now you're looking 4 to 6 week injury.
I'm wondering, just because, you and I know that 5th metatarsal, sometimes it doesn't have the greatest blood supply depending on where the fracture is. So he's in a boot right now. When would you elect to put a pin in there or use some hardware if it was, would it have to be displaced, or is this one of these hairline spiral fractures, just small avulsion? I know you can't tell, but I'm just asking you kind of how do you guys assess these things? When do you decide to use hardware, so to speak? Yeah.
I think it's 2 things. One is the acuity of it. If it's somebody who's had like nagging pain and then suddenly has sharp pain, and you get an x-ray and you see evidence that the bone is very thick in there, basically meaning it's been a stress injury that then broke, that one usually needs fixation. Also, the location of the bone. So think about a dog bone. It has that long central area, dog bone meaning the ones that get chewed up. Yeah. And if you have it in that middle, that long central area, those are the ones that are more amenable, where the blood supply, like you said, is not as good, that we're more likely to fix it, potentially bone graft it. If it's all the way at the end of the bone, the part that sort of bows out and gets bigger, there's much better blood supply there. And those heal really, really well with just protection for a little while.
Interesting.
So it's a combination of the timing, and it's a combination of the location of the fracture.
Yeah, when you speak of bones, the dog bone, I always just think of Wilma and Betty on the Flintstones. They always were wearing like a femur in their hair or something like that, weren't they?
Exactly. That's a good reference. Not a lot of people out there below our age get it, but I like that.
I'm just showing my age and our age. Thanks for laughing at that. I appreciate that.
Yes, I love it.
Yeah. One of these times, so that when you hear foot injury, And fractures, sometimes the first thing I think about with athletes and football players that are planting and pushing off, sometimes is that Liz Frank injury, which is a totally different thing. One of these times we're going to have to talk about Liz Frank when we get a player, okay? All right?
Yeah.
David Montgomery, Detroit Lions. These guys, 12-2, looking pretty good. They're having a great season. I like myself a little Dan Campbell. I like how he coaches. And this guy's a hard runner, hard runner. David Montgomery, again, he's out with an MCL sprain, and they're saying he's out, and he may require. They're talking about getting the opinion to do surgery. Why would must be a significant talk about the MCL? Why would you have surgery, grade it, and stuff like that? What's going on here?
Yeah, so I've used the analogy on the podcast before about how the MCL is sort of like a big thick piece of duct tape down the inside part of your knee. And the idea behind that is that it's very broad from front to back. And so most of these injuries are sort of peel-off injuries where they get pulled off the bony attachment, but not all the way. So usually when you start thinking about why would this guy need surgery and he doesn't have any other damage, like not an ACL or anything else, it's usually the location. So peel-off injuries are more common above the knee joint, so where it comes off of the femur, the thigh bone. But occasionally you get peel-off injuries down below. And so if it comes off the tibia, the lower bone, right, you can sometimes have a situation where normally that ligament sits right up against the bone, and above it are where the hamstring tendons come down and attach. And so if it peels off and it lifts up enough that it's on top of the hamstring tendons, then it won't stick back down again as well. So I think that's where it is. Now, the interesting sidebar is he's already gotten a third opinion as of this afternoon, and they're now saying they're not going to put him out for the season, and he's actually hopeful he can come back for the playoffs. So it's a very interesting thing. As a physician, we get a lot of people, not athletes, who kind of shop around a little bit to try to get opinions. And it's not that anything's wrong. It's just understanding, like, what are the chances that something may or may not heal. So I think he probably found somebody who said, hey, let's protect it with a brace. Yeah. Let's maybe consider something adjunctive, maybe like a orthobiologic thing, like a platelet injection or something like that, to stimulate healing and see if there's a chance, because if you have surgery, you're done for 6 to 9 months. Yeah. So maybe there's a chance. They've got a great season. Maybe there's a chance, adjunctive, we can try this for 4 to 6 weeks, and maybe you're available for the playoffs and you can help us win a Super Bowl. So right now it's up in the air, but the idea behind surgery is usually if it's a distal bottom end injury and it's peeled off the bone, those are the ones that we say, you know what, this probably isn't going to heal tightly and it might need surgery to stabilize it. Interesting. What if it ruptures in the middle? What if it tears in the middle, completely, in the middle with an MCL? Do you just immobilize them, and then that ligament just kind of heals back together? No, that's a great question, Shannon. The thing is given the fact that they don't say anything else happened, that's super hard to do. It's super hard to rupture your MCL mid-substance without rupturing your ACL. Right. So like, that's why I'm saying, hey, probably not the case. But those are the ones, those combinations sometimes, mid-substance, MCL with an ACL, and those need like a true reconstruction. They actually need a graft put on them, just like the ACL. So a piece of tissue. And nowadays, you always like to ask the questions of new developments, new ideas. So nowadays it's grafting, or it's doing what we call internal bracing something, which is putting a strip of non-biologic tissue, like essentially a suit, what they call like a suture tape, attached to the bone top and bottom, which in the long run it's not equivalent to your own tissue, but it's protecting that tissue while it heals, so you can be more aggressive with rehabbing and stuff like that. Wow, they've come along. I've also talked to docs that were studying, where they do a platelet patch or something like that, where they put that over the graft and they kind of enhance that. They stimulate that blood there for the healing. And it's so interesting, fascinating what's going on. We can talk about biologics all day long, but I think I agree with you. I would guess the Lions are looking at
trying to figure out. I mean, he's not going to play this weekend. That's for sure. That's David Montgomery. He's going to be out. He may be out for a couple games until the playoffs, and they might just get through. They're 12-2, and I think they play the Bears, which are 4-9 or something like that. So they probably are saving him, trying to get him healthy for playoffs. He's an important part of their team, the Lions. That is. Great information. Thank you very much. Patrick Mahomes, I like this guy. Man, I like this guy. He's a player. Man, this guy's a player. He does things, and he throws the ball, and his eyes are, I don't know, he's all over. But I saw that he took a hit. It looked benign. It was one of those pile-up things, right? And he gets up, and he's limp. And the first thing I thought, watched on TV, is, oh, wow, lower extremity. Because he's had this history of ankle problems, I think, over the years. But he does. He has a high ankle sprain. That's why I figured that leg got torqued down there. We talked about high ankle sprains. But he's tough. What do you think? He's going to start or sit this weekend?
Well, I think you called it like you've seen it. I mean, he today was a full participant in practice today. Jeez. So I think he's a warrior. But in the back of my mind, Shannon, I feel like he's one of those guys who's like, I'm never going to give anybody the chance to call me the next Drew Bledsoe. Oh. Drew Bledsoe hurt himself.
Yeah.
Tom Brady came in. And
exactly.
Drew Bledsoe.
Exactly.
Again,
Yeah.
So he's like, I'm never going to let anybody else step in here and show that I'm not the magic man behind the center.
Oh, yeah. He's tough.
He does have a high ankle sprain. He has practiced with it. He's shown in the past with that injury that he's been able to play through it. I mean, he's played through that in prior Super Bowls. And I think he knows his limits. I think he realizes, like, if I'm going to hurt my team, I'd take myself out. And I think he feels he can, perform at the level that's needed.
Well, they're going up. I mean, I believe they play the Texans, and the Texans. Yep. I think the Texans are no slouch. They're 9-5. Chiefs are 13-1. They've already clinched a playoff spot. I don't know what they're playing for. I guess you still play for home field, probably. I imagine, and I'm not even sure why he would. Well, anyway, he's going to play. That's what you're saying. He's going to play.
Correct.
I mean,
Correct.
Yeah, he's a baller. He is a baller. Patrick Mahomes does play a good game. He does some things that are pretty amazing. Interesting. It's amazing. I think we talked about this when we started this. Here we are going into week 16 of the NFL, and you look at these athletes, and I just have so much respect for them. I mean, look at the speed, the power on that field. That is 50 by 100, and they are moving fast. They've got guys that are 6'4", 260, running 4'6", 4'7", 4. I mean, their speed is just amazing. And the injuries that these guys sustain, and there's never a dull moment. You know what I'm saying? I mean,
yeah.
Go ahead.
I was thinking, no problem, Shannon. I was thinking about it recently. I'm excited this weekend. Tomorrow we've got a big game in my family. We've got Indiana playing Notre Dame.
Oh yeah, buddy.
This first round of the CFP. Okay. And I a little background on myself. My son went to Indiana, so I'm a huge IU fan. But my wife's uncle was a Notre Dame football player, and my brother-in-law was a Notre Dame football player.
Oh my God, are you serious?
But as an example here, so my wife's uncle, he played in 1948, 1949. He was, part of their, national championship run. And I was looking him up just to think about it because I knew him when he was an older man. He was a starting, player, and he was 5'10", 170 pounds.
Yeah.
Okay.
Yeah.
And that's the difference there.
I know.
Like that's not even a kicker nowadays. Okay?
Yeah. No, I know.
And so the amazing thing is, like, where these guys have gotten with their size and how they prepare themselves and how they lift and everything else. It is, you stand on a sideline and you're amazed. You wonder, are these people even the same as you?
Yeah.
Because it's just like, what world do they live in that they could be so incredibly big and powerful?
It's a car wreck. Every play for a lot of those players is a car wreck. I mean, we're soft tissue. We're ligaments, tendons, muscles, and bones. I mean, something's got to give. And if you get through the season, look at Nick Chubb. Nick Chubb has been in the NFL for 3 years, maybe if I don't know, maybe more. I don't know. But you're right. Mm-hmm. Nick Chubb had a terrible injury in college, rehabbed. Got to give the guy credit. Big ups. Came back, did the same injury, in the NFL, and now just recently fractured his foot. I mean, some guys just have, I guess it's just luck or bad luck, if you want to call it like that, right? You know what I'm saying?
And it's happening. It's happening everywhere right now. They did a great study just came out looking at baseball pitchers, and I know we're jumping sports.
No.
But when you look at what's going on right now, it's linear correlation with their velocity of throwing and their injuries. And so what makes you amazing is what tears you apart.
Exactly.
So, there's a limit. There's only so far we can push our body. So it's trying to find that happy balance between like, oh, hey, how do we prevent injuries? How do we educate people? And, how do we make them smarter? And that's where, what IRG does is incredibly important in sort of teaching people, like, what do we do to sort of widen our fairway so we can perform at our highest level and not have these devastating injuries. But, at that top level, they've got a narrow fairway. They can only go, they can't push themselves too far.
It's amazing. Well, just think about it. You just talked about your wife's uncle in 1948 playing for Notre Dame at 5'10", $170, right? That's like that's a kicker. I mean, he probably was running too. He probably was fast for his time to be a collegiate athlete. Took that at Notre Dame, but he was probably running like a 10-600 or whatever. You know what I'm saying?
Correct. Exactly.
And now
he was a quarterback, a halfback, and a D-back. Those are the three positions he played back then. Yeah.
Wow.
Yeah.
Wow, that's amazing. My dad's 94 years old, and he's still independent, lives at home and stuff like that. My dad grew up in a small town in Eastern Washington, but in his days there was no TV, but there was radio, and that's how he learned to love Notre Dame, is because Notre Dame, you could hear the football, broadcast. He graduated in 1948. My dad graduated in 48 from high school, so I bet you my dad had listened to your wife's uncle play in big Notre Dame fan. That's crazy. What a small world. What a fly, Eagles fly. You know what I'm saying? Here we are. That is our Start or Sit podcast here at IRG Physical and Hand Therapy. And I want to give a shout out to Dr. Hawkins at Washington Orthopaedics in Olympia, Washington. Fantastic orthopedic surgeon, sports medicine specialist, as you can tell just by listening and talking to him and how he explains things. Dr. Hawkins, have a great day. Enjoy your evening. And it was nice to talk to you.
Thank you very much, Shannon.